So let's get into today's three questions. When should you start Medicare? What's your timeline? Should you delay just because you can? And how do you protect your future options? Hey everyone, welcome to Coffee with Casey, the weekly Medicare conversation that helps you navigate with confidence. I'm Casey Album. I'm the Senior Medicare Advisor with the Album Insurance Group located in Margate, Florida. We're a family-owned agency that's been helping people with Medicare for more than 30 years. And over that time, we've had the privilege of helping thousands of families here in Florida and all throughout the country. Many of my clients refer to me as their Medicare co-pilot. And as many of you know, I'm also a pilot. And one of the first things that you learn in aviation is that timing really matters. You don't just show up at the airport ready to go. You need to know where you're going, when you're going, what the conditions are going to look like, what your alternates are, and whether you're actually ready to go. Most of the work for a successful flight actually starts before you ever leave the ground or before you ever leave for the airport. I think Medicare is very similar because one of the biggest misconceptions about Medicare is that everybody has to start at age 65. And that's not necessarily true. For some people, starting Medicare at age 65 makes perfect sense. But for other people, delaying all or part of Medicare may actually make sense for them. For some people who technically could delay Medicare, starting at 65 might still be the better financial and healthcare decision in the long run. So today, we're going to answer, when should you actually start Medicare? And we're going to keep it simple. And we're going to look at three things: your timeline, your choices, and your future option. And then stick around to the end because I'm going to tell you how you can get a copy of my free Medicare enrollment roadmap. It's an easy to follow guide that can help you begin putting all of these pieces together for yourself. Today, we're coming to you at a different time and from a much different location. And that's because Christine and I are traveling this week and we are in northern Arkansas. So go ahead and grab your coffee and let's get started. We're going to start with our Medicare myth of the week. And that is, everyone has to start Medicare at 65 in order to avoid penalties. I hear this one all the time, but here's the reality. Turning 65 gives most people their initial enrollment period. It's a window that lasts 7 months, 3 months before your birthday month, and 3 months after. But that doesn't mean that everybody has to start all or even part of Medicare at 65 during your IEP. If you or your spouse are still actively working and you're covered through current employment, you may be able to delay starting Medicare Part B and use a special enrollment period later on without a late enrollment penalty. Now, the important word there is may, because this is where so many people get into trouble by taking a general Medicare rule and just assuming it applies to their specific situation. So, well, turning 65 is definitely the time to understand your Medicare decisions. It isn't automatically the date that everyone should make the same Medicare decision. And here's our question of the week. How does COBRA work after age 65? Now, this is a really important one. Let's say you're 66, you're laid off or you retire, and your employer says, no problem. You can continue your health insurance through COBRA. Sounds great, right? Well, there's a Medicare catch. COBRA generally does not count as coverage based on current employment for purposes of delaying Part B. Your Part B special enrollment period generally runs for 8 months after your employment ends or your job-based coverage ends, whichever happens first. Electing COBRA doesn't restart that clock. That's a big distinction. You don't want to discover that distinction 8 or 9 months later. In addition, COBRA moves into the second payer position after age 65. It's not primary insurance. So in essence, it becomes a really expensive form of secondary coverage. And if you don't have Medicare at Parts A and B in place, you may be on the hook for the bulk of the costs when you run into a serious health issue. So if you're leaving employment after age 65, regardless of why, and COBRA is offered to you, don't simply ask, can I keep COBRA? Ask, how does COBRA coordinate with Medicare in my particular situation? That question can save you a lot of frustration and a lot of money. So let's get into today's three questions. When should you start Medicare? What's your timeline? Should you delay just because you can? And how do you protect your future options? So let's start with the first question, knowing your timeline. And we're going to start with the alphabet soup. There's two terms that I want you to remember: IEP, which stands for initial enrollment period, and SEP, which stands for special enrollment period. Your initial enrollment period is your first opportunity around age 65, 7 months, 3 months before your birthday month itself, and then 3 months after. But let's say you're 65 and you're still working. Maybe you're 67, maybe you're 70. If you have qualifying coverage based on your own or your spouse's employment, you may be able to delay Part B and then use what's called a special enrollment period, or SEP, when that employment or coverage ends. And then we have Part D, and that's a completely separate question. For prescription coverage, you want to know whether your employer drug coverage is considered creditable. And what creditable means is just that it's expected to pay on average at least as much as standard Medicare drug coverage. Now, if you go 63 days or more without Part D or other creditable prescription coverage after you become Medicare eligible, you can face a Part D late enrollment penalty later on. I had a client that did this. She waited until her mid-70s to enroll. She was paying over $30 a month for a zero premium Part D plan. That was just the penalties. Now, remember, whenever your Part B starts, you'll have 6 months to enroll in any Medicare supplement plan without worrying about any underwriting conditions or pre-existing conditions. That's called your Medigap open enrollment window. So if you're still working, delaying Part B not only saves you from paying your Part B premium until you're ready to leave the group plan, it also protects your Medigap open enrollment rights as well. And one distinction around job-based coverage, when I'm talking about group insurance, I'm talking about a large employer. That's a company that has at least 20 or more people on the payroll. So we don't want you to lump everything together. Part B has different rules. Part D has different rules. Medigap has different rules. Your employer plan also has rules. And then your situation is different than everyone else, and that matters. And that's why I always say, know your individual timeline before you make any decisions. Or the next question, question 2, is should you delay just because you can? And this is where the conversation starts to get a little more interesting. So let's say that we've established that you can delay Part B. Great. The next question is, should you? Now, those aren't the same question. I talk to people all the time who assume I'm still working, so obviously I'm just going to keep my employer insurance. Well, maybe, but let's actually take the time to compare it. What are you actually paying for in the employer plan? How much is your portion of the premium? What about your spouse? What's your deductible and what's your maximum out of pocket? What does it cost to cover your spouse? Is there a spousal surcharge? What are your copays? What about co-insurance? What's your provider network look like? And then what would Medicare plus a Medicare supplement in Part D actually cost you? Let's compare apples to apples, because sometimes the employer plan wins and it makes sense to keep it in that case. Great. But sometimes people discover they're paying roughly the same amount, sometimes even more, for coverage that actually gives them a lot less flexibility than Medicare in a supplemental plan. And so that brings us back to the Freedom First framework. Protect your healthcare freedom, protect your retirement income, and retain control over your healthcare decisions. The goal here isn't to get you onto Medicare as quickly as possible. The goal here is to figure out which option better supports your life, your retirement. And don't forget your family, by the way. Maybe Medicare looks fantastic for you, but your 62-year-old spouse still needs the employer plan, or your 24-year-old son or daughter who's still in college needs the coverage. That matters. And that may be part of your decision. Or perhaps your employer has another option. We've actually seen employers who will provide retirees with a stipend or some type of reimbursement arrangement that can help offset individual Medicare-related coverage rather than keeping them on the traditional group plan. It's kind of a win-win, because for the employer, they get you off the group plan, but they help you defray some of the cost of your Medicare coverage. Not every employer offers that. You're going to have to ask your HR and benefits, but if something like that's available to you, well, the math may change again for you. So don't assume. Compare apples to apples. And by the way, you don't just want to compare premiums. You want to compare the healthcare experience that you're getting for those premiums on the employer side as well as on the Medicare side. But the third theme, or the third question, is how do we protect our future options? And this is the part I really don't want people to miss. If you're considering Medicare with a supplement, you need to understand your Medigap open enrollment period. Under federal rules, once you're 65 or older, your 6-month Medigap open enrollment period starts when your Part B starts. Some states have different rules and offer you a additional flexibility. But as a general rule, it's 6 months from the date, or really the first of the month when your Part B is activated. During that period, you're generally going to have your broadest protections to be able to purchase a Medigap policy regardless of your health. So during that 6-month Medigap open enrollment window, basically every Medicare door is open, but it's a one-time window and it doesn't come back every fall. And that's incredibly important because I've seen this happen too. People are still working, they're covered on a group plan, they start Part B while they're still working. Well, guess what? You've also started that 6-month Medigap clock and you're paying double premiums. So I don't want someone casually saying, I'll just turn Part B on now and figure out the rest later. No, let's understand what else that decision starts. Too many people miss this one and find out later on that they can't just get a supplemental plan when they need it because they can't pass underwriting. Again, when that 6-month window ends, a lot of those doors start to close. A few months ago, I was talking to a really nice couple in Central Florida. When they both turned 65, during their initial enrollment period, they both enrolled in Medicare Advantage because it just seemed easy. They didn't have an extra premium. It was the same company that they had had before they turned 65. But what they didn't realize is by signing up for that plan, they were essentially letting their Medigap open enrollment window run out. And fast forward 3-4 years down the road, the husband ended up being diagnosed with a serious pulmonary disorder. And he wanted to go to Mayo Clinic to be able to see some of the best pulmonary specialists. Unfortunately, Mayo Clinic didn't take his Medicare Advantage plan. Well, it had been several years. His Medigap open enrollment period ran out. He wanted to switch, and now he couldn't because he couldn't pass the medical underwriting. And this is one of the biggest reasons behind my Freedom First framework. We want to protect your options while you still have them, because choosing the right path isn't simply about what works for this month or for this year. It's about preserving as much freedom as possible for the years ahead. Looking at that couple, I had to diplomatically tell them that I wasn't able to help them because with that diagnosis on his record, he wasn't able to switch. I bet they wish they had looked at it a little bit differently and had preserved their freedom. That conversation really stuck with me. So let's get into some of the questions I've been asked this week. First one, I'm working past 65. Does that automatically mean I should delay Medicare? No, not at all. What it does mean is that we should compare. First, we want to determine whether your coverage allows you to delay Part B without penalty. Certain types of coverage, like a small employer that's less than 20 employees on the payroll, or maybe you're retired military with TRICARE for life, those types of coverage are going to move to the second payer position and you'll have to start Part B. If you're on COBRA insurance as you're approaching Medicare, a lot of people do this. They retire early, they get a voluntary separation package, they use COBRA as their bridge to Medicare. Well, again, we know COBRA moves into the second payer position. So that's another scenario where you're going to want to start not just Part A, but Part B at 65. Now, large group plans are different. If it's more than 20 employees on the payroll, typically that's considered creditable coverage. As long as you've maintained continuous coverage since you turned 65, you'll be eligible for that special enrollment period once you're ready to come off that group plan. But before you do that, we want to compare the actual costs and benefits. Sometimes the employer plan might have a lower premium, but then you're still dealing with network issues, referrals, and hefty out-of-pocket costs. A lot of employer plans are the HMO PPO model, which is network-based managed care. And in some cases, even if the costs are similar, Medicare might be better in that case because you're going to have better access. And just like Advantage plans, employer plans can change from year to year. The network can change, the benefits can change, the out-of-pocket costs can change. And of course, you've got the carrier and provider negotiations that happen all the time. My friends who live in Broward County, who have job-based coverage through Florida Blue, and doctors at Memorial firsthand, because you're looking for different providers right now. So sometimes staying with the employer plan makes sense. Other times Medicare makes sense. Eligibility to delay isn't the same as a conscious, well thought out decision to delay. Second question is, can I start Part A at 65 and delay Part B? Often, yes, particularly if you qualify for premium-free Part A. Over 99% of people do, and you have qualifying current employment coverage for Part B. By the way, this applies to you if you're the primary employee or you're the covered spouse. But There's also an important wrinkle to consider, because if you're contributing to a health savings account, premium-free Part A can be retroactive by up to 6 months when you enroll in Part A after 65. When you have an HSA, you are no longer eligible to contribute to that HSA, neither is your employer, until you start Medicare. Now, a lot of people, it's smart, if they're still working and they have an employer plan with an HSA, to continue with that plan, delay Medicare Part A and Part B, continue making those HSA contributions. But you've really got to pause them at least 6 months prior to when you start Medicare. Otherwise, there may be a true up at tax time. If you don't take care of that, there could be some additional penalties. Definitely something you want to talk to your tax professional about. I know sometimes people plan a retirement date and then there can be a surprise, they get laid off, and that changes things too. So if an HSA is involved, that's something that you want to plan, if you can, before enrolling. And you find yourself enrolling sooner than expected due to a job loss. I had a gentleman this week that was in the same exact scenario. His job-based coverage had an HSA. He was planning to work another year and he got laid off. This is one of those things where you really want to talk to your CPA, your tax preparer, because you may have to pay back some or all of the HSA contributions that you made during that 6 months period of time. You have to pay it back at tax time. If I delay, third question, if I delay Part B, do I lose my Medigap open enrollment? Generally, no. Your Medigap open enrollment window starts when your Part B is activated and lasts for 6 months. So for someone 65 or older, you want to enroll in a Medicare supplement plan during that 6 months window. If you're going to continue to work, you want to delay Part B so that you protect that Medigap open enrollment right until you're ready to come off of that group plan. You just want to make sure that you maintain continuous creditable coverage and apply for Part B during your special enrollment period so that you can avoid the late enrollment penalties. Now, what happens if you have multiple employers past 65? Well, that means that you're going to have proof of continuous creditable coverage throughout that time. And so you're going to have to string together proof of creditable coverage from those 2 or 3 or however many employers you've had. And that's another reason timing matters so much. It's another reason why a lot of folks like to sign up for Medicare when they become eligible, especially if they don't have younger dependents or a covered spouse that needs it, because now they have flexibility and they can decide when they want to retire or maybe make a job change and not have insurance be the deciding factor. Here's your coffee challenge this week. If you're approaching 65 and you're still working, don't ask, do I have to start Medicare at 65? Ask, what are all of my options and which one best supports the retirement or lifestyle that I'm planning? That's a much better question. So next week on that episode, we're going to continue building on this. And we're going to talk about the difference between Medicare Advantage plans and Medicare supplement plans. And if you're approaching Medicare, working past 65 or planning a retirement date, I think you're going to want to stay with us over the next several weeks. If today's conversation helped, I've created a free guide. It's called the Medicare Enrollment Roadmap that can help you begin designing your own Medicare strategy. If you'd like a copy, just comment roadmap and I will send you a copy. And if you're approaching Medicare and you'd rather sit down with someone and compare your specific options, see how all this applies to your own situation, you're more than welcome to schedule a Medicare planning session, personalized, by the way, with me or someone on my team. You can just go to medicarequotes.com/Facebook to grab a time on the calendar. Call the office directly, 954-970-4760, or just type plan in the comments and I'll reach out to you. There's never any pressure. We just look at where you are, where you're headed, and what options make the most sense for you. Because whether you're starting Medicare at 65, 67, 70, or somewhere in between, the important part isn't choosing Medicare as quickly as possible. It's really about understanding your choices before you make them. Thank you for spending a few minutes and having a cup of coffee with me. And remember, the best Medicare decisions aren't made under pressure. They're made with a plan. I'll see you next time for another episode of Coffee with Casey. Have a great day.